Last night, you went to sleep feeling completely normal. No chest pain, no dizziness, nothing that would have made you think twice. But while you were asleep, your brain may have been quietly dealing with reduced blood flow. Not because of an illness, and not because of any medication, but simply because of the position your head and body were resting in. Before we go any further, if you find this kind of information valuable, take a second to hit that like button and subscribe to the channel. We upload helpful videos like this every single day, and it really helps more people see them. I'm Dr. Carter, and over the years I've spent a lot of time looking into research on heart and brain health in older adults. And there's one pattern that almost never comes up in a regular doctor's visit. The way you sleep, the angle of your neck, which direction you're facing, how your spine is positioned, has a real measurable effect on how well blood reaches your brain throughout the night. Here's something that should grab your attention. Stroke risk jumps nearly 49% in the hours between 6 a.m. and noon, largely because of a natural morning surge in blood pressure. That surge isn't random, and how prepared your body is for it depends heavily on what happened during the hours of sleep right before it. So before you think, I've slept this way my whole life. It's fine. Stick with me. Over the next several minutes, we're going to walk through 6 common sleep habits, ranked from mildly concerning to genuinely risky. Then I'll share 2 positions backed by research that could make a real difference for your brain and heart starting tonight. Quick question before we dive in. Are you a back sleeper, a side sleeper, or a stomach sleeper? Keep that in mind, because we'll be coming back to it. Let's set the stage first, because understanding what's happening in your body makes everything else click into place. In your 20s and 30s, your blood vessels are flexible. They stretch, adjust, and compensate automatically. Sleep in an odd position, and at worst you wake up with a stiff neck. Your body handles the rest on its own. After 60, things change. Your arteries become stiffer and less elastic. The smaller vessels supplying your brain lose some of their flexibility. Pressure inside your skull becomes more sensitive to body position, and the system that regulates your blood pressure overnight becomes slower to react. Here's an important detail. In a healthy sleeper, blood pressure naturally drops by about 10 to 20% during sleep. This dip is protective. It's part of how your body recovers overnight. But if your sleeping position is compressing the wrong blood vessels, restricting airflow, or putting pressure in the wrong places, that natural dip gets disrupted. And when that happens, your cardiovascular system doesn't get the recovery time it needs. Keep that idea in mind as we go through the list. Mistake number 1. Sleeping completely flat with no elevation. This one sounds harmless, maybe even ideal. No pillow or just a thin one, body perfectly level, spine aligned. Sounds like textbook advice, right? But here's what often gets left out of that picture. When you lie completely flat, especially after 60, blood and fluid don't distribute the way they used to. Without any incline working in your favor, the fluid that cushions your brain inside your skull can build up slightly, gradually increasing pressure inside your head. The small vessels in your brain, already showing some wear from age, end up under a bit more pressure than they should be for 7 or 8 hours straight. Research published in a sleep medicine journal found that even a modest elevation, as little as 15 degrees, led to measurable improvements in pressure regulation and blood flow during the night. Here's the symptom most people misread. You wake up around 3 a.m. with a dull headache, maybe behind your eyes or at the base of your skull. You chalk it up to getting older, take some water or a pain reliever, and go back to sleep. But what if that headache is your body's way of telling you the pressure has been too high for hours? The fix is simple. A 15-degree elevation of your upper body. We'll cover exactly how to set that up safely toward the end of this video. Mistake number 2. Stomach sleeping. The position that twists everything. This one tends to surprise people because stomach sleeping feels harmless. You're not putting weight on your heart, so you're not compressing your lungs. It's just lying face down. What's the issue? The issue is your neck. When you sleep on your stomach, you physically can't breathe with your face flat against the mattress, so you turn your head to one side, usually the same side every night, since most of us are creatures of habit. That means your neck stays rotated, sometimes close to 90 degrees, for 7, 8, even 9 hours straight. Running along either side of your neck are 2 important arteries, the vertebral arteries, that supply blood directly to your brainstem, your cerebellum, and the parts of your brain responsible for balance, breathing regulation, and coordination. When your neck stays turned sharply to one side for long stretches, these arteries can become compressed, like stepping on a garden hose. Blood flow doesn't stop completely, but it becomes restricted. And that restriction, repeated night after night for years, adds up. Studies looking at extreme neck rotation have shown measurable reductions in blood flow through these vertebral arteries. While that research was originally focused on other contexts, the underlying anatomy applies just as much to a sustained sleeping position. There's a second issue with stomach sleeping too, your breathing. With your chest pressed against the mattress, your diaphragm can't fully expand. You never get a truly full breath, which means slightly less oxygen with every inhale all night long. Combine that with restricted blood flow to the brainstem, and for someone in their 60s or beyond, especially with any history of high blood pressure, this becomes a slow, cumulative strain. If you're finding this useful so far, drop a comment letting me know. It helps me understand who's watching and what matters most to you. Mistake number 3, stacking multiple pillows. Let's stay in the neck region, because this next one is something people often do with the best intentions. Yet it creates a very similar problem through a different mechanism. Stacking 2, 3, or even 4 pillows under your head is common and often for good reasons. Acid reflux, sinus congestion, snoring, or breathing difficulties. A modest amount of elevation can genuinely help with these, but when that elevation becomes excessive, your head gets pushed too far forward and your chin drops toward your chest. That forward bend, known as cervical flexion, puts pressure on the same vertebral arteries we just talked about, but this time from the front. There's also a third structure that often gets overlooked here, the internal jugular vein. This is one of the main pathways your brain uses to drain used blood back toward your heart. When your neck is bent forward too much, that drainage pathway gets partially restricted. Blood doesn't drain as efficiently, pressure inside the skull builds slowly, and your brain's overnight cleanup process becomes less effective. The next morning, this can show up as brain fog or a heavy feeling behind your eyes, that frustrating sensation of sleeping 8 hours and still feeling drained. It's not laziness. Your brain may simply not have drained properly overnight. The fix here is simple. 1 pillow, ideally a contoured, supportive pillow that follows the natural curve of your neck instead of forcing your head forward. Many people notice their morning headaches improve within just a week of making this one change. If this is helping you rethink your setup, go ahead and tap that like button. It really helps this kind of information reach more people who wake up tired without knowing why. And let me know in the comments, how many pillows are you currently using? Mistake number 4, sleeping on your right side, especially with heart-related concerns. This one tends to surprise people, because side sleeping is generally considered one of the better options. And for most people it is, but the direction you face actually matters quite a bit. Your heart sits slightly toward the left side of your chest. When you lie on your right side, gravity pulls your heart slightly away from its natural resting position. At the same time, your body weight presses down on the right side of your torso, right where one of your body's largest veins, the inferior vena cava, runs. This vein's job is to carry blood from your lower body, legs, abdomen, and digestive organs, back up to your heart. When it gets compressed by lying on your right side, that return flow slows down, and your heart has to work harder just to keep itself properly filled. For a healthy person, this isn't a big deal. But for someone managing borderline heart function, mild heart failure, or chronic high blood pressure, the heart is already working close to its limit. Adding extra nightly resistance is like running an engine slightly harder every night, year after year, and that wear adds up. Research on heart failure patients has found that many instinctively avoid sleeping on their right side, even before they consciously understand why. Sometimes the body knows before the mind does. If you mentioned earlier that you're a right side sleeper, this one's especially relevant. And don't worry, we'll get to the solution shortly. Mistake number 5, sleeping in a tightly curled fetal position, knees pulled up, shoulders rounded in, chin tucked toward the chest. For a lot of people, especially women over 60, this is the go-to position. It feels cozy and protected. Emotionally, that makes sense. But physically, a few things go wrong at once. First, your lungs get compressed. Your rib cage can't fully expand, so every breath is shallower than it should be. Over a full night, that adds up to slightly less oxygen reaching your blood with each breath. Second, the blood vessels behind your knees get bent and partially compressed, reducing circulation to your lower legs. If you already deal with swollen ankles or poor circulation, this position can make that worse. Third, your neck is flexed forward, which brings us right back to the same vertebral artery and drainage issues we discussed earlier, just as part of a whole body pattern of compression. Research on sleep and breathing has shown that sustained spinal flexion during sleep measurably reduces how much air you take in per breath. A small percentage reduction, repeated across every breath for 8 hours, adds up to noticeably less oxygen-reaching brain tissue that's already aging. If this sounds like you, the fix doesn't have to be dramatic. Try placing a body pillow between your knees and opening up your hip angle slightly. Small adjustments, real benefits. Mistake number 6, eating late or drinking alcohol close to bedtime. This one ties everything together, and it's probably the most common habit on this entire list. Picture this: dinner around 7:30, maybe a glass of wine while watching TV, and bed by 10. Sounds like a completely normal evening for millions of people over 60. But here's what's happening inside your body during that scenario. After a large meal, your body redirects blood toward your digestive system, away from your brain and heart. In younger bodies, this shift happens smoothly. But in older bodies, with less flexible arteries and a slower response from your nervous system, this redirection can cause brief dips in blood flow to the brain, moments where your brain is temporarily a little undersupplied. Now add alcohol into the mix. Alcohol widens your blood vessels, which causes your blood pressure to drop. Your body then compensates by tightening those vessels back up and raising pressure again. Over the course of the night, your blood pressure can swing up and down repeatedly. And in vessels that already have some stiffness or age-related wear, that back and forth puts extra strain on the artery walls. Research on blood pressure patterns has found that even moderate alcohol consumption within a few hours of bedtime can interfere with the natural overnight blood pressure dip we talked about earlier. Without that dip, your cardiovascular system ends up under more strain throughout the night. What does this feel like in real life? Well, you wake up around 2 a.m. with your heart pounding, maybe a little sweaty. You assume it was just a vivid dream and grab a glass of water. But what you actually experienced may have been your blood vessels trying to stabilize themselves after a wave of pressure swings they weren't quite ready for. The fix? Try to finish eating at least 3 hours before bed. If you drink alcohol, stop 4 to 5 hours before sleep. And a short, gentle 15-minute walk after dinner, not exercise, just movement, can help kickstart to digestion, steady your blood sugar, and give your cardiovascular system time to settle before you lie down. Now, the 2 positions your body will thank you for. Position 1, sleeping on your left side. This is, hands down, the most well-supported sleep position for heart and brain health in adults over 60. When you sleep on your left side, gravity works with your heart's natural position rather than against it. The inferior vena cava, that large vein we talked about, runs along the right side of your spine. So left side sleeping takes pressure off it entirely. Blood returns to your heart more freely, and your heart doesn't have to work as hard. But here's the part that really changed how researchers think about sleep position. About 10 years ago, scientists identified what's now called the glymphatic system, essentially your brain's overnight cleanup crew. While you sleep, fluid moves through the spaces between brain cells, flushing out waste products, including certain proteins that, in excess, are linked to cognitive decline later in life. Research published in a major neuroscience journal found that this cleanup process works most efficiently when you sleep on your side, and the left side in particular appears to offer a slight advantage due to the natural shape and positioning of the brain. So left side sleeping isn't just about tonight's circulation. It's about how effectively your brain clears out waste over the years, which matters a great deal for long-term brain health. If you've never been a side sleeper, try using a full-length body pillow to support your front so you don't roll onto your back. And place a pillow between your knees to keep your spine neutral. Give it about a week. Your body adjusts faster than you'd expect. Position 2, back sleeping with a 15-degree elevation. If side sleeping just isn't comfortable for you, maybe due to shoulder pain, joint issues, or simply decades of habit, there's a safe and effective alternative, elevating your upper body between 15 and 30 degrees. This isn't about stacking pillows under your head. Your entire upper torso needs to be on a gradual incline. A wedge pillow works well, and an adjustable bed frame works even better. What does this do? It helps gravity assist blood flow back from your lower body, reduces the buildup of pressure inside your skull that flat sleeping can cause, and helps keep your airway more open for better oxygen flow throughout the night. Add a small pillow under your knees to support your lower back, and you get an evenly balanced position that takes pressure off any single area. This setup can be especially helpful if you deal with mild sleep apnea, frequent morning headaches, swollen legs, or blood pressure that stays elevated even while you sleep. A few more things that matter for your sleep environment. Keep your bedroom cool and somewhere between 65 and 68 degrees. A cooler room helps your body temperature drop naturally, which supports deep, restorative sleep and helps lower blood pressure overnight. If your room is too warm, your heart rate stays elevated and you spend more time in lighter, less restorative sleep. Watch your light and screen exposure. Blue light from phones and tablets in the evening can delay your body's transition into deep sleep, and that's exactly when your brain's overnight cleanup process is most active. Try putting screens away earlier and reading something physical instead. And don't underestimate noise. Sounds that don't fully wake you can still cause brief interruptions in deep sleep. Tiny spikes in heart rate and stress hormones that you won't even notice, but your body does. A white noise machine or a pair of earplugs can help eliminate this. One more tool worth considering. An overnight pulse oximeter. A small device that clips onto your finger and tracks your blood oxygen levels while you sleep. If your levels regularly drop below 92%, that's worth discussing with your doctor. It could point to sleep apnea or circulation issues, both of which are connected to increased stroke risk, and it's the kind of information your doctor will genuinely want to see. Here's what I want you to take away from all of this. Your cardiovascular health doesn't pause when you fall asleep. In many ways, the hours between midnight and dawn are some of the most important hours of your entire day. And your sleep position is one thing you have complete immediate control over starting tonight. Pick just one thing from this video. Try sleeping on your left side. Add a 15-degree elevation. Stop eating within 3 hours of bed. Switch from 3 pillows to one supportive one. Any single change, kept up consistently, adds up over weeks and months and years. If this video gave you something useful, something your last doctor's visit maybe didn't cover, do me a favor and hit that like button and share it with someone who needs it. A parent, a spouse, a sibling over 60 who keeps waking up with unexplained headaches. And if you haven't already, go ahead and subscribe. We post helpful videos like this every single day, and you won't want to miss what's coming next. Take care of yourself, and I'll see you in the next one.